looking at you. You're a picture in a frame.
Hi there, this is Dr. Westwood at Country Friends Veterinary Clinic here in Royse City, Texas. And we are going to go over how to feed a cat, or any animal for that matter, using a feeding tube. So I've got Metz here. That's going to be our example here to show you how. But the key things I want to make sure that y'all remember is when y'all are getting ready to feed, we got to get everything prepared first. So we will have obviously some food, and it's important that this food, Metz is doing a lot better, so we're actually going to be removing the tube today, so he may eat a little bit on his own with this food. But we do need to have our syringes, so we're going to have these 2 syringes here. One is going to be for the food, and then the other we are going to have a water syringe to be able to flush that tube when we're done. With the food, it is important, this tube is pretty small in size. Let me see if I can take his sweater off here so y'all can see. He's got his little sweater and he's going to eat for us too. So you can also see that they can eat with a feeding tube in place. This is just a little shirt that we've got on him that our patients go home with that helps keep this tube down. So it's a pretty small tube, and this tube is actually going in the side of his neck. Over here, we'll see if he'll sit still, where you can actually see it, okay, going on the side of the neck, goes directly into the esophagus there. So this is a pretty narrow tube, so food has to be blenderized for it to be able to go through this tube. So you do need to make sure that you've got either an immersion blender or using your regular blender, okay, to be able to prepare the food. The food also needs to be at room temperature. You don't want it cold, you don't want it hot. So we just need to make sure that that's prepared, okay, there. I like to get these guys comfortable, so we've actually got a little warmed bed for him so that he's comfortable with where he's at, because this does take some time. It takes about 15 or 20 minutes from start to finish, so just be prepared and be prepared to stay there for a little while. So we've got his warm bed. I've also got a little brush, okay, to make it fun for him. So we've got our food syringe, okay, we've got our water syringe, we've got our food, we've got something to occupy our time. And then I also like to have an extra cap just in case, okay, we misplace this or this cap falls off. I just want to make sure we have an extra cap ready. And then obviously also some paper towels too, because sometimes it can get a little bit messy. So make sure that you're getting prepared. All right, what I'm going to do is actually pull up Metz food. So you can see how easy this pulls up. So this is a nice, okay, slurry, going to be very easy for this tube to go through. I am not going to be feeding him a whole lot because we're going to be removing that tube, but just draw up whatever amount that your doctor tells you to, and then just make sure that there's no air, okay? So I don't know if y'all can see there's some air up here at the top. We're actually going to get all that air out of there because we don't want to be injecting air, okay, into his stomach there. So we've got that food tube, okay, prepared. So I'm going to take actually water first. Anytime we're feeding, we always want to follow with water first, okay, to make sure that that tube is active and not clogged. So we're going to actually go in here and we're going to remove this little stopper. I'm going to pinch. You can either pinch the tube like I'm doing with my fingers, or if you want to, you can actually bend it, because I don't want, again, a bunch of air to be sucked into that belly. We're going to remove this little stopper, okay, right here. So that's the little stopper that we've got. And I'm actually going to connect my water with him. So we're going to put that on pretty snug, unkink it, okay, there. And then I'm going to turn this so you can actually see the quantities. I'm just going to give him about 5 cc's of some water. And I am going to kind of hold this. I don't want that to accidentally pop off. We're just going to kind of go 5 cc's, okay. A little bit slow there, and then we're just watching for him to get really uncomfortable, or if he does any coughing or sneezing, we want to stop, okay, and pay attention. That went really easy, so we're definitely ready to go with food, okay, at this point. Same thing, we're going to pinch that tube or bend it, whatever is easiest, okay, for you. We're going to be pulling that off. And now we're going to put the food tube, okay, on there. So this is a little bit thicker than water, and it will be a little bit harder, okay, to push, okay, there. And again, give them some loving, okay, so that they enjoy this there. Same thing with the water. We're going to only do about 5 cc's every couple minutes or so. So we're going to do 5 cc's, okay, with them, and I'm going to hold this also again to make sure that it doesn't pop off and spray food everywhere. But we're going to actually give him some, okay, and if you have to stop and kind of pet him, beautiful, you can do that. Perfect, okay. And then we're gonna wait, okay? We're gonna just wait a few minutes with them. And again, this is a good time, kind of use your brush if they like to be brushed. Make sure that it's just a fun, okay, ordeal for the cat and for you too. If, when we are feeding, what we are looking for, you know, Metz is doing very, very well. So his tummy is not upset right now. But when we're starting this process, we usually have some really sick cat. They may be more likely to vomit or get nauseous, okay, with food. If he starts getting uncomfortable, he's kind of, you know, opening that mouth, burping, just doesn't seem like he's enjoying it, we definitely want to stop. If you have to stop, just stop. You can actually, you know, for a brief period, go ahead and pull this off, okay, there. Put this back on, and we can wait just a little bit. You don't want to leave food in that tube for any long period of time because that will clog or has the potential to clog that. But if you've got to stop, okay, he's not, okay, having this, or we're getting up, you know, that tummy's upset, by all means stop. Take your time. This is not something that we want to rush through. So he did really good, okay, with that. Again, same thing. I'm kind of pinching that tube. I'm going to give him a little bit more food. And again, turn that so you can see. And I'm just holding that on so it doesn't pop off. And you can see this is harder than the water. Okay, I'm having to use a little bit more force, okay, with it. And we're going to kind of stop. And this is how we would proceed until we have fed him, okay, all of the food that he needs. Once he's done, we're going to actually flush with some water, just like what we did in the beginning, to make sure that we don't have any residual food, okay, left in that tube. So we're going to go ahead and flush with water again, pinching that tube. I'll pull that tube off, and we're going to actually put our water, okay, tube on with him. He's such a good cat, okay, such a good kitty cat. And same thing with this, anytime we're flushing when we're done with feeding, we want to at least give about 10 cc's of water to make sure that that tube is completely flushed out, and we're not leaving any. So I'm going to give about 10 cc's. Again, you got to go slow, okay, with it. We're not rushing, okay, with this. I'm going to give right here up until about the 30. We'll stop. And kind of give him a little time. So this tube is actually not in the stomach. This tube is actually in the esophagus. It's sitting right in front of the stomach. So we still have to go from the esophagus to the stomach. So you can't give a large quantity because it takes a little bit of time. If you give too much at one time, it's going to come up to the esophagus and may cause them to vomit. So that's one of the reasons we go as slow as we do. I'm going to go ahead and give them another 5 cc's, make sure that's all flushed. And you can see how easy, okay, that is with the water, a lot easier with the water. And we're all done, okay? So he's been fed, he's had some water. I'm going to take this syringe off. Again, I'm going to pinch. I'm used to pinching it, so I'm going to pinch. And I'm going to put our little cap, okay, back in there. And then he is done, okay, with that. That is the end of our feeding. Matt, you are such a good boy. Look at that. We had fun showing everybody how to do this. You're a good cat.
Why am I looking at you? You're a picture in